How does persistent depressive disorder coexist with other mental health issues? Have you ever wondered why some people struggle with multiple mental health challenges at once? This is especially true for individuals with persistent depressive disorder, often called dysthymia. This condition is not just a simple case of feeling down. It is a chronic form of depression that lasts for at least 2 years. The symptoms may not be as intense as those seen in major depressive episodes, but they can be more enduring. What makes persistent depressive disorder particularly complex is its tendency to co-occur with various other mental health issues. Studies show that a significant number of individuals with this disorder also experience personality disorders. The rates of this overlap can range from 50% to 70%. Common personality disorders found alongside persistent depressive disorder include borderline personality disorder, avoidant personality disorder, and obsessive-compulsive personality disorder. When both conditions are present, the severity and duration of depressive symptoms can increase. Anxiety disorders are another common companion to persistent depressive disorder. Conditions such as social phobia, panic disorder, and generalized anxiety disorder frequently appear in patients with this chronic depression. These anxiety issues can worsen depressive symptoms and make treatment more complicated. Other psychiatric conditions can also coexist with persistent depressive disorder. For instance, post-traumatic stress disorder, somatic symptom disorder, and even issues like alcohol abuse and binge eating disorder have been observed alongside this chronic depression. This broad range of possible comorbidities highlights how complex mental health can be. In children and adolescents, persistent depressive disorder often appears with attention deficit, hyperactivity disorder, and anxiety disorders. Many young individuals with this disorder may face multiple challenges, complicating both diagnosis and treatment. The coexistence of persistent depressive disorder with other mental health issues can lead to greater functional impairment. Nearly half of adults with this disorder experience serious difficulties in their daily lives. This impairment can worsen when other conditions are present. From a clinical standpoint, it is essential to recognize and address these coexisting issues for effective treatment. Therapeutic approaches often need to be tailored to manage both persistent depressive disorder and any accompanying disorders. For example, cognitive behavioral analysis system of psychotherapy has shown promise in treating persistent depressive disorder, especially when combined with medication. This approach can be adapted to address other mental health conditions as well. Persistent depressive disorder rarely exists in isolation. Its frequent coexistence with personality disorders, anxiety disorders, and other psychiatric conditions creates a more complicated clinical picture. This complexity requires careful assessment and integrated treatment strategies to improve outcomes for those affected.